Welcome to the Deep Dive, where we extract the core knowledge on a vital topic to give you the information you need, clearly and engagingly.
Glad to be here.
Today, we're navigating the sometimes overwhelming world of eating well before and during pregnancy.
It truly is a sea of advice out there, isn't it? Often with conflicting currents. Our aim today is to distill the most current and reliable recommendations
Yeah, exists.
and, balance them with real-life practicality. Healthy eating in the real world isn't always picture perfect.
Totally agree. This isn't about chasing some unattainable ideal. It's really about empowering you to make informed, positive food choices, choices that support your well-being and, of course, the healthy development of your baby.
Absolutely. What you nourish yourself with during this time has both immediate and, well, lasting effects.
And let's quickly touch on that popular idea of eating for two. It's a common phrase.
It is. It's a sweet sentiment, but from a nutritional standpoint, the reality of your caloric needs is actually a bit more nuanced than just doubling everything. We'll definitely explore that.
Okay, let's unpack this. When we think about laying the right nutritional groundwork during pregnancy, what are the fundamental elements? What should we focus on daily?
Well, the bedrock is variety. Really think about incorporating fresh fruits and vegetables across the color spectrum, the rainbow.
Right, the rainbow.
Each color offers a different profile of beneficial plant-based nutrients. Then whole grains are vital for sustained energy and good digestion, thanks to their fiber content.
Okay.
Foods rich in calcium and vitamin D, like dairy or fortified plant-based alternatives, those are essential building blocks. And of course, reliable sources of protein are key.
And hydration.
Oh, definitely. Alongside staying well hydrated with around, say, 64 ounces of liquids daily.
64 ounces, that might seem like quite a lot to some people. Any practical tips for getting enough fluids in?
It can feel like a lot.
Huh.
But remember, this includes all fluids, milk, juice, even the water and fruits and veggies counts. Keeping a reusable water bottle with you is a great visual reminder to sip regularly. And some people find adding a squeeze of lemon or lime makes plain water a bit more appealing.
Good tips. Now, I've heard a lot about eating smaller meals more frequently during pregnancy. What's the thinking behind that?
Right. Eating smaller meals at regular intervals helps keep your blood sugar levels more stable. That can be particularly helpful in managing morning sickness, especially early on.
Makes sense.
And later in pregnancy, this pattern can also help prevent or lessen heartburn, which is another common issue.
Okay, now let's talk calories. It's not just a free pass to eat whatever, right? Those extra calories.
Not at all. Actually, in the first trimester, your calorie needs generally don't increase much, if at all, from your pre-pregnancy baseline.
Really? First trimester, no extra.
Pretty much. It's in the second trimester that an additional intake of about 340 calories per day is typically recommended.
And what does 340 calories look like, roughly?
To give you an idea, it's about the equivalent of a peanut butter sandwich, maybe, or a cup of whole milk paired with a small chicken thigh, something like that.
Okay, that puts it in perspective.
Then in the third trimester, the recommendation increases just slightly more to around 450 extra calories daily.
So it's a modest increase overall, not doubling your intake. What about for individuals who were already carrying extra weight before pregnancy? Do these guidelines still apply?
That's a really crucial point. Current research actually suggests that individuals with obesity may not need to add any extra calories to support a healthy pregnancy.
Interesting.
It's always, always best to have an individual discussion about your specific needs with your healthcare provider.
Right. And regardless of the number, those extra calories should come from nutrient-dense foods, not empty calories, correct?
Absolutely. You want those additional calories to deliver a real nutritional boost. Think foods rich in protein, calcium, iron things found in whole, unprocessed options.
To steer clear of.
Yeah, steer clear of things like chips, cookies, sugary drinks, stuff that provides calories but not much in the way of vitamins and minerals.
It's easy to say eat perfectly, but, life happens. What about challenges like limited money or trouble accessing fresh foods or just a super busy schedule?
Those are very real hurdles for so many people. Let's be honest, making ideal food choices every single meal isn't always feasible. And everyone has moments when they crave a treat, right?
Of course.
The key is to maintain an overall awareness of your dietary patterns. Just make healthy choices as often as you can. Every positive food choice you make does contribute to your baby's well-being.
That's a reassuring and practical way to look at it. I also saw a mention about the role of fathers and partners in supporting healthy eating.
Yes. This whole pregnancy period is actually a fantastic opportunity for partners to also embrace a balanced diet and a healthy lifestyle.
Good point. For their own health, too.
Exactly. Yeah. Not only can it contribute to their own long-term health, meaning more healthy years with their child, but it also provides invaluable support for the pregnant person navigating dietary changes. The core principles of healthy eating benefit everyone in the house.
Okay, let's shift gears and talk more specifically about what to eat. Food groups, the half-a-plate idea. Tell us about that.
Right, the half-a-plate rule is a simple visual tool. Basically aim to fill roughly half your plate with colorful fruits and vegetables.
Half the plate, fruits and veggies.
Okay. Yeah. The other half should then be divided between protein sources and grains. And beyond just proportions, think about that variety of colors, aiming to eat a rainbow throughout your day or week.
A literal rainbow at every meal sounds challenging.
Not necessarily all at once. But the idea is to get a wide range of colors over time. Those pigments in fruits and veggies, they come from different phytonutrients.
Phytonutrients?
Yeah, natural plant compounds with health benefits supporting your immune system, maybe protecting against chronic diseases. So more colors means a broader spectrum of those good compounds.
That's a great visual. Our info also mentions the USDA's MyPlate. What's the main takeaway there for pregnancy?
MyPlate, you can find it online at myplate.gov. It offers a visual guide to the 5 main food groups. And it gives personalized recommendations based on things like your age, weight, activity level, and stage of pregnancy. It's a really helpful resource.
And for people who like tracking things, there are apps and things.
Exactly. Apps like MyPlate, MyFitnessPal, or Noom let you log your food and see how it lines up with recommendations, track nutrients too. Or there's a downloadable food diary some prefer. Periodically tracking can give you good insights into your habits, maybe show areas to adjust.
Good to have options. Now, the resources also mention some critiques of MyPlate and Harvard's Healthy Eating Plate as an alternative. What's the difference, basically?
Yeah, MyPlate has faced some criticism, maybe about overemphasizing animal protein. Some say industry influence. Harvard's plate offers a slightly different visual, some different recommendations. Our discussion today actually kind of blends insights from both. For instance, MyPlate highlights dairy. Harvard suggests it more in moderation. We're aiming for a balanced view, taking the strengths from different models.
Got it. So let's dive into specific food groups, starting with grains. What should we prioritize?
Grains give you essential stuff like iron, B vitamins, minerals, and fiber. The key advice is to make at least half of your grain intake whole grains.
Whole grains? Why?
Whole grains contain the entire kernel bran, germ, endosperm. That means they keep more of their natural nutrients. Think amaranth, brown rice, oatmeal, barley, quinoa, even popcorn counts.
Popcorn.
Yeah. When buying bread or cereal, check the ingredients. Look for whole wheat flour or whole oats listed first.
So what about the other half? Are refined grains like white bread or white rice a total no-go?
Well, it's generally best to limit them. The milling process removes a lot of the good stuff, but some refined grains are enriched. That means certain vitamins and minerals like folic acid are added back in, so that offers some benefit.
Okay. And for those with gluten issues, celiac disease.
Right. Crucial to strictly avoid wheat, barley, rye, triticale. And you need to be careful with oats. Make sure they're certified gluten-free to avoid cross-contamination. There are good resources online for managing a gluten-free diet safely.
Good to know. Moving to vegetables. We know they're good, but any specific types or cooking methods best during pregnancy?
Absolutely. Veggies are nutritional powerhouses, fiber, vitamins, minerals. For cooking, methods like steaming, microwaving, stir-frying tend to preserve nutrients best. Boiling can sometimes let nutrients escape into the water.
Steaming. Okay.
And variety is key here too. Aim for that rainbow again to get a wide range of benefits.
Tell us more about the veggie rainbow. Any specific categories?
Yep. We often group them. Dark green veggies like spinach, broccoli rich in certain nutrients, red and orange ones like carrots, sweet potatoes known for others. Then you have dried beans and peas, legumes like lentils and chickpeas, great plant-based protein and fiber.
Legumes count as veggies and protein.
Often considered in both categories. Then starchy veggies like corn, green peas give energy, though some guidelines suggest moderating potatoes a bit due to blood sugar impact. And then just a broad category of other veggies, cucumbers, onions, mushrooms, lots to choose from.
Okay. And fruits, the sweeter side of produce?
Fruits are also incredibly valuable. Fiber, potassium, vitamin C, folate, lots of good stuff. Again, aim for that rainbow of different fruits.
Fresh is best.
Freshly picked, in season, often has the highest nutrients and can be cheaper. especially at farmers markets. But frozen fruit is fantastic too. It's usually picked at peak ripeness and frozen quickly, locking in nutrients.
What about canned?
Canned is okay, but check the label for added salt, sugar, or corn syrup. Try to choose fruit packed in its own juice or water.
And dried fruit. Juice. Smoothies.
Dried fruit is a handy snack, but it's concentrated in sugar, so watch portion sizes. Homemade smoothies with whole fruit are great. Store-bought ones, though, often packed with added sugar, so be careful there.
And juice.
Well, 100% fruit juice has some vitamins, but it lacks the fiber of whole fruit. And many drinks labeled juice, or those fruit snacks, are mostly added sugar, like corn syrup. Best to limit those or avoid them.
Okay. Dairy products often pushed for calcium. What are the recommendations here?
Both My Plate and the Healthy Eating Plate see dairy and fortified soy alternatives as good sources of calcium, protein, potassium, B vitamins A and D. They differ slightly on servings, though. My Plate suggests 3 servings of low-fat dairy, while Harvard's plate recommends 1 to 2, emphasizing moderation.
So maybe somewhere in between.
Potentially, depending on your overall diet. Yogurt and cheese are good alternatives to milk, but just be aware of sugar, sodium, and saturated fat content in some products.
What if someone is lactose intolerant? How can they get calcium?
Lots of options. Lactose-free milk and lactase enzyme pills are available. Some find cultured dairy like yogurt or kefir easier to digest. Smaller servings might also help.
And non-dairy sources.
Absolutely. Canned fish with bones, like sardines or salmon. Dark green leafy veggies, dried beans, nuts, and seeds. Calcium-fortified tofu and plant-based milks or juices, just check the label to ensure they are fortified with calcium and vitamin D.
Good point about checking labels.
Yeah. And if dairy isn't part of your diet, your provider might recommend supplements for calcium, vitamin D, maybe potassium or magnesium.
Let's switch to protein. Where should we get it, and how much is needed during pregnancy?
Protein is crucial. Builds and repairs tissues for both you and the baby. Sources are animal-based lean meats, poultry, eggs, seafood, and plant-based nuts, nut butters, seeds, soy, beans, peas, lentils.
Lots of choices.
Definitely. The general recommendation during pregnancy is about 70 to 80 grams of protein per day. That's roughly 20 grams more than the average pre-pregnancy need.
And get that from food, not supplements.
Ideally, yes, primarily from whole foods. Prenatal vitamins don't usually have much protein, and relying on protein supplements can sometimes cause imbalances.
What about healthy choices for meat and fish? Any guidelines?
Good food safety is key. We'll talk more about that. Choose lean cuts of meat, trim fat, drain grease. Try to minimize processed meats and red meat due to potential links with heart disease and cancer. For seafood, focus on types low in mercury but high in those beneficial omega-3s.
We'll get to the specific fish later. What if you don't eat meat or fish?
If you're vegetarian or vegan, you need to pay close attention to getting enough iron, calcium, vitamin B12, and zinc, which are often higher in animal products. Vegans are typically advised to take a daily vitamin B12 supplement, as it's mainly found in animal sources.
Okay, now those empty calories, should they be totally eliminated?
Empty calories are foods with lots of calories but few nutrients. Think candy, soda, or foods with some nutrients but also lots of solid fats or added sugars, like ice cream or sugary cereals.
So minimize them.
Exactly. Occasional small treats are fine, life happens, but generally minimize them and balance them out with nutrient-dense foods most of the time.
We've covered the big groups. Anything else for daily choices? Spices, maybe?
Yes. Spices and herbs are fantastic. They add flavor and enjoyment without adding fat or sugar. Use what you like. Explore different cultural seasonings. Ask friends. Experiment. Makes healthy food much more interesting.
Great point. Okay, that's a solid overview of what to eat. Now let's zoom in on specific nutrients critical during pregnancy. Fats often get a bad rap, but they're important, right?
Absolutely vital. Healthy fats are crucial for your baby's brain growth, nervous system development, and for absorbing fat-soluble vitamins A, D, E, and K.
Which fats are best?
The most beneficial are omega-3 fatty acids. Some research suggests they might help reduce risks like preterm labor, high blood pressure during pregnancy, even postpartum depression.
Where do we find omega-3s?
Major sources are flaxseed, fatty fish will list as safe ones later, and flax oil or fish oil supplements. You also find them in avocados, soybeans, walnuts, chia seeds, certain oils like canola and soybean, and some omega-3 enriched eggs.
Is a supplement usually recommended?
Many providers do recommend a daily supplement with around 300 milligrams of omega-3s, specifically DHA, during pregnancy.
What about other fats?
Unsaturated fats from plants, olive oil, avocado oil, canola oil are also considered healthy. Include them in moderation. Saturated fats, mostly from animal sources, and things like palm oil should be limited as they can raise cholesterol.
Got it. Now, organic foods. Is it worth the extra cost during pregnancy?
That's a common question. Some observational studies hint at benefits, but people choosing organic often have other healthy habits and maybe higher incomes, which clouds the picture a bit.
So it's not definitively proven better.
Not definitively from controlled trials, no. If organic fits your budget and preference, great. If not, don't stress. You might consider prioritizing organic for produce known to have higher pesticide residues, the dirty dozen, things like strawberries, spinach, apples.
The dirty dozen. Okay.
But whether organic or conventional, washing all produce well or peeling it is the most important step. Some also suggest organic dairy, meat, and eggs to minimize chemical or hormone exposure. They might have slightly more omega-3s.
Washing is key. Okay. Let's get into some specific key nutrients. Salt, the advice seems to have changed.
It has. For a long time, limiting salt was advised. But now we understand that salting food to taste actually helps maintain healthy fluid balance during pregnancy. It's necessary.
Good to clarify. What about iodine? Not often discussed.
Iodine is crucial for your thyroid function and your baby's brain development. Table salt in the U.S. is usually iodized, but salt in processed foods often isn't.
So use iodized salt.
Yes, and the American Academy of Pediatrics recommends pregnant and breastfeeding individuals take a daily supplement with 150 micrograms of iodine.
Okay. Choline, another one that's maybe less known.
Vital for baby's brain and spine development. You need about 450 milligrams daily during pregnancy. Importantly, most prenatal vitamins don't contain choline.
Where do we get choline then?
Good food sources include eggs, lean meat, poultry, seafood, beans, peas, lentils, soy, and peanuts.
Good list. Folate and folic acid, these are well known for preventing birth defects. What's the difference and the recommendation?
Folate is the natural form, vitamin B9, found in leafy greens, beans, nuts. Folic acid is the synthetic form added to fortified foods like cereals and used in supplements. Both are vital, especially very early in pregnancy, for blood cell formation and baby's brain and spine development.
And how much is needed?
The recommendation is 600 micrograms of dietary folate equivalents daily during pregnancy. It's hard to get enough from food alone, so a daily supplement with at least 400 micrograms, that's 0.4 milligrams of folic acid, is generally recommended, starting before conception and through the first trimester.
Before conception, okay. Calcium for bones and teeth, how much?
Calcium is crucial, especially in the third trimester as baby's skeleton develops rapidly. It also protects your bone health. Aim for 1,000 milligrams daily. If you're under 18, it's 1,300 milligrams.
And magnesium helps with calcium.
Yes. Adequate magnesium, around 400, 500 milligrams daily, helps your body use calcium effectively.
Iron often low during pregnancy.
Very common. Iron is needed to make hemoglobin, which carries oxygen to your baby and your own cells. Baby also stores iron in the last weeks of pregnancy for their first few months of life.
So how much iron? Supplement needed.
The recommendation is a daily intake of 27 milligrams during pregnancy, usually via a supplement, as it's hard to get that much from diet alone.
Any tips for taking iron supplements? Absorption? Side effects?
Yeah, vitamin C boosts absorption, so taking it with orange juice or vitamin C-rich food helps. Avoid taking it with calcium supplements, some antacids, or caffeine, as they can interfere. Side effects like nausea or constipation are common. Taking it with food, trying different brands, or splitting the dose might help manage those.
Okay. What about vitamins A and D supplements needed?
Vitamin A is important for vision, skin, bones, but too little and too much can be problems. Deficiency is linked to issues like preterm birth, while excess, especially early on, is linked to birth defects. So routine high-dose A supplements usually aren't recommended. Get it from food.
And vitamin D?
Vitamin D is crucial for bone growth, calcium absorption, and might reduce risks like preeclampsia. We get it from sunlight and fortified foods. Your provider might recommend a supplement, maybe 400 IU daily, especially in winter northern areas if you have darker skin or limited sun exposure.
Makes sense. Now, our resources mentioned a table with my plate servings based on a 2,600 calorie diet example, but individual needs vary a lot, right?
Absolutely. That table is just an example for one specific profile. Your own needs depend on many factors: age, pre-pregnancy weight, activity level, whether you're carrying multiples. Best to get personalized advice from choosemyplate.gov or your healthcare provider. The table also gives general daily limits for things like added sugars, saturated fat, and sodium, which are good targets.
Got it. Let's talk fluids again. Proper hydration, why is it extra important in pregnancy?
Staying hydrated helps deliver nutrients to the baby. It also helps prevent common issues like constipation and urinary tract infections. And, contrary to old myths, drinking enough actually helps prevent excess fluid retention and ankle swelling.
Oh, interesting. So drinking water doesn't cause swelling.
No, it helps your body maintain the right fluid balance. Aim to drink enough so your urine stays pale yellow, usually around that 64 ounces or 2 quarts daily mark.
What counts towards that?
Water is best, but milk, 100% juices, soups, decaf teas all contribute. Just remember, caffeine is a diuretic and makes you lose fluid. So caffeinated drinks shouldn't be your main hydration source and might not fully count towards that 64-ounce goal.
Okay. Last nutrient topic, carbs and sugars. What's the guidance?
Carbs are your main energy source. Aim for about 175 grams daily, or roughly 45–60% of your total calories. Focus on high-quality, high-fiber carbs, whole grains, legumes, starchy veggies, nuts.
What about simple carbs? Fruit, bread?
Some simple carbs are fine fruit, dairy, even unsweetened refined grains like some breads or pastas in moderation. Try to reduce things like white rice, white potatoes, and sugary baked goods.
And sugar itself.
Excess sugar isn't great tooth decay. Links to obesity, diabetes risk. Understanding the glycemic index helps. Low GI foods release sugar slowly better for blood sugar stability. Fructose, lactose are lower GI. Refined sugar, high fructose corn syrup are higher.
What about sugar substitutes? Artificial sweeteners?
Those approved by the FDA, like aspartame, sucralose, stevia, are generally considered safe in moderation during pregnancy. But people with PKU need to avoid aspartame. Always best to use them sparingly.
Wow, that covers a lot on nutrients. Now, a topic many people wonder about and maybe stress over, weight gain during pregnancy.
Yes, it's definitely a focus for many. It's good to know that weight gain is usually slow in the first trimester, maybe just 1 to 5 pounds total.
Only 1 to 5 pounds, okay.
Then in the second trimester, it typically picks up, maybe ½ pound to 1 pound per week as the baby grows. Amniotic fluid increases, your blood volume expands, all that necessary stuff.
Is there such a thing as gaining too quickly?
Yes. A sudden large gain, like 5 pounds in 1 week, especially with other symptoms, could signal something like preeclampsia and needs checking by your provider.
There can be a lot of pressure about hitting the right number on the scale. How should people approach this?
It's so important to remember your provider monitors weight as one part of assessing your and the baby's well-being. Try not to compare yourself to others or get fixated on the number. Gaining too little increases risks, like having a premature or low birth weight baby. Gaining too much increases risks like preterm labor, gestational diabetes, and high blood pressure.
So what are the general recommendations? Is there one target weight gain?
No single number fits everyone. It's really individualized based on your weight before pregnancy. Guidelines use pre-pregnancy body mass index, BMI, though BMI itself isn't a perfect measure of health. It's the tool used for these guidelines.
Okay, so the recommendations vary by BMI category.
Exactly. If someone was underweight before pregnancy, BMI under 18.5, the recommendation is generally 28 to 40 pounds total gain. Normal weight, BMI 18.5, 24.9, aim for 25 to 35 pounds. Overweight, BMI 25, 29.9, the range is 15 to 25 pounds. And for those with obesity, BMI 30 plus, is typically 11 to 20 pounds.
It's helpful to see those ranges, and that weight isn't just baby, right?
Not at all. A good chunk is the baby, yes, but also the placenta, the growing uterus, amniotic fluid, increased breast tissue, significantly more blood volume, plus necessary fat stores and tissue fluid to support pregnancy and breastfeeding later.
So, using the example, someone 5'4" and 160 pounds pre-pregnancy has a BMI around 28, putting them in the overweight category. Their target gain would be 15, 25 pounds, but these are just guidelines.
Precisely. They're guidelines. Many people gain more or less and have perfectly healthy babies. The focus should really be on healthy habits, eating well, staying active appropriately, rather than obsessing over the scale. In fact, some doctors think these IOM guidelines might even be a bit high, especially for those starting overweight or with obesity.
That's interesting. So if someone in that overweight group gains, say, only 10 pounds, but the baby's growing well and the doctor isn't concerned.
Research actually shows overweight individuals who gained less than recommended often had similar healthy baby growth and outcomes, and they tended to retain less weight postpartum. So as long as the baby is thriving and your provider is happy, hitting a specific number isn't the main goal.
That's really good perspective. And after birth, what's typical for weight loss?
You usually lose a fair bit in the first few weeks, baby, placenta, fluids, etc. Then sensible eating and exercise help most people gradually lose the rest over the following months. But it takes time, and the timeline varies hugely. Be patient with yourself.
Okay. Pregnancy brings lots of changes, including digestive ones. Let's talk common concerns. Nausea or morning sickness.
Oh, yes. Affects about 75% of pregnant people. And morning sickness is a misnomer. It can hit anytime. Usually fades after the first trimester, but not always.
What causes it?
Likely the surge in pregnancy hormones, maybe digestive changes. Sometimes even changing your diet can trigger it initially until your body adapts. The good news is, if you are healthy starting pregnancy, you usually have reserves to nourish the baby, even if you eat poorly for a bit early on.
Any tips for managing it?
Yes. Eat small, frequent meals, include protein. Keep bland snacks like crackers by the bed. Eat some before getting up. Trust your gut. Eat what sounds appealing. Identify and avoid trigger smells.
What about specific remedies?
Some find relief sipping peppermint tea or smelling lemon. Ginger is a classic helper. Ginger candies, tea, natural ginger ale, powdered ginger in food. Increasing vitamin B6-rich foods might help whole grains, nuts, seeds, legumes.
Supplements.
You can discuss B6 supplements with your provider, maybe 10-25 milligrams every 8 hours, up to 100 milligrams daily. If that's not enough, a B6-doxylamine combo medication is safe and effective, prescribed by your doctor. Acupressure wristbands help some people too. But if it's severe, causing dehydration or weight loss, definitely see your doctor.
Okay, heartburn, another common one, especially later.
Very common. Stomach acid, backing up into the esophagus, that burning feeling. Happens because the growing uterus pushes on the stomach and hormones relax the muscle, keeping acid down. Plus, digestion slows.
How to manage heartburn?
Avoid trigger foods. Spicy, fatty, fried things, tomatoes, citrus. Try heartburn-reducing foods. High-fiber, alkaline things like bananas, watery foods like melon, non-fat dairy. Eat small meals. Drink fluids between meals, not large amounts with meals. Eat slowly. Don't lie down right after eating. Prop yourself up in bed. Antacids, especially calcium-based ones, can help. Check with your provider first.
Constipation, too. Why does that happen?
Food moves slower through your intestines during pregnancy. Good for absorbing nutrients, but bad for regularity. Plus, the uterus presses on the large intestine. It can also worsen hemorrhoids.
Tips for staying regular.
Exercise helps. Plenty of fluids. High-fiber foods are key. Fruits, veggies, whole grains, bran, prune juice, flax meal. Aim for at least 28 grams daily. Ensure enough magnesium too, maybe 400 milligrams plus date. Over-the-counter fiber supplements are generally safe. Avoid routine laxatives. If iron supplements seem to be the culprit, talk to your provider about switching types.
Okay. Food craving's the classic pregnancy symptom, and sometimes weird ones.
Yes. Intense desires for specific foods, sometimes things you never usually eat. Why? Theories include nutritional needs, cultural permission, maybe just wanting something forbidden or feeling cared for when a partner fetches it, usually harmless. Indulge healthy cravings. For unhealthy ones, have a small amount, then eat something healthy to fill up.
What about cravings for non-food things? That's pica, right?
Exactly. Craving ice, clay, cornstarch, or even smelling things like gasoline or bleach. It's surprisingly common. It can have side effects, mild to severe, for both parent and baby, depending on what's consumed.
What should someone do if they experience pica?
Talk to your caregiver or a counselor. There's absolutely no shame it happens. They can help you find coping strategies and avoid anything harmful. It's important to address it.
Definitely. Let's move to food safety. Extra important during pregnancy.
Yes. Certain bacteria and contaminants can pose a risk to fetal development. The risk is small overall, but taking precautions is important.
Mercury in fish is a big one. What's the guidance?
Mercury can harm a baby's developing brain and nervous system. It concentrates in larger, older fish. But fish are also great sources of nutrients, so it's about balance.
So which fish are okay?
The FDA advises 2 to 3 servings a week from the best choices. List things like salmon, shrimp, tilapia, cam-lite tuna, cod, sardines, or 1 serving a week from the good choices. List like halibut, snapper, albacore tuna.
And fish to avoid?
Avoid the highest mercury fish. Shark, swordfish, king mackerel, tilefish, marlin, orange roughy.
Okay. What about foodborne bacteria? Listeria, salmonella.
Pregnancy increases susceptibility slightly. These infections are rare, but can be serious risk of miscarriage, preterm labor, stillbirth. So good food safety practices are crucial.
What are the key practices?
Minimize high-risk foods. Unpasteurized milk soft cheeses, raw fish, shellfish, raw sprouts, raw undercooked eggs, meat, poultry, hot dogs, deli meats, unless heated until steaming.
Keep things clean.
Yes. Wash hands thoroughly before and after handling food. Rinse raw, produce well, scrub firm items.
Separate raw and cooked.
Crucial. Keep raw meat, poultry, seafood separate. Wash cutting boards, knives, plates used for raw foods thoroughly before using for anything else. Don't cross-contaminate.
Cook food properly.
Yes, use a food thermometer to ensure safe internal temperatures. Heat hot dogs, deli meats until steaming. And a side note, if you have a gas stove, use the vent fan or open windows when cooking to reduce exposure to benzene fumes.
Good tip. Chill foods quickly.
Definitely. Refrigerate perishables within 2 hours, 1 hour if it's hot out. Eat leftovers within a couple of days. Keep the fridge at 40 degrees Fahrenheit or below. Freezer at 0 degrees Fahrenheit. Clean the fridge regularly. Pay attention to food safety alerts and recalls.
Okay, that's comprehensive. Our final section is about special circumstances, multiples, health conditions. Sounds like extra nutritional care is needed then.
Absolutely correct. If you're pregnant with multiples or have conditions like diabetes, high blood pressure, or a history of eating disorders, being extra conscientious about nutrition is vital. Dietary counseling is highly recommended.
Briefly, what about twins or more? Different needs.
Yes, higher calorie needs maybe 50 extra in the first trimester, up to 700 extra by the third, compared to a single baby. Getting enough weight gain by 24 weeks is really important to reduce preterm birth risk. Nutrient needs are also higher protein, folic acid, vitamin D, B12, calcium, DHA.
Teenage pregnant.
Unique needs, because the mother is still growing too. Very high requirements for calcium, magnesium, phosphorus for bone health for both. Comprehensive guidance is essential.
What if someone gets pregnant again very soon after giving birth?
Nutrient reserves, like iron and calcium, might be depleted. They might need extra calories and nutrients, including folic acid. Important to talk to a caregiver.
And things like eating disorders, high blood pressure, diabetes.
Eating disorders bring challenges with weight gain acceptance. Nutritional and psychological support is key. For high blood pressure, good nutrition, fluids, exercise, avoiding alcohol, caffeine can help reduce complications. The DAH diet might be beneficial. For diabetes, pre-existing or gestational, healthy diet and activity are crucial for blood sugar control. Recommendations often involve managing carb intake, choosing low GI foods, fiber, healthy fats, maybe specific supplements like probiotics or vitamin D, all under guidance.
Makes sense. Lastly, a really important practical issue. Finding and affording healthy food. Access isn't equal.
It's a huge issue. Income inequality, food deserts, they create real barriers to healthy eating for many.
What resources are available for lower-income people?
Programs like WIC for women, infants, children, and SNAP, food stamps, are vital federal resources providing food assistance and nutrition support. Check their websites witga.fns.usda.gov and fsp.fns.usda.gov. The USDA National Hunger Clearinghouse can direct you to local help. Also search locally for food banks, meal sites, little free pantries.
What about stretching the budget? Choosing cheap but healthy options.
Lots of strategies. Frozen and canned fruits, veggies are often just as nutritious and cheaper. Choose ones without added salt, sugar, fat. Stock up on sales. Compare unit prices. Buy fresh produce in season. Learn to store it properly.
Dates on food? Sales.
Understand best buy versus safety dates. Some items near their date are fine and discounted. Day-old bakery can be a deal. Use coupons, but only for things you need. Compare unit prices everywhere, even dollar stores.
Cooking from scratch.
Usually much cheaper and healthier than prepared foods. Buy staples like rice, dried beans, oats. Learn simple recipes, freeze portions. Join store loyalty programs. Buy generic brands, often just as good.
Other ideas.
Look for CSAs, community-supported agriculture, for local produce deals. Make the healthiest choices possible, even at fast food places or convenience stores. Least processed, lowest salt, sugar. Search online for food rescue, gleaning, buy nothing groups, or apps like Too Good To Go that offer surplus food cheap or free.
Really helpful tips. Okay, before we wrap up, there's one more fascinating area. The microbiome. What is it and why does it matter in pregnancy?
Yes, the microbiome. It's the community of trillions of microbes, bacteria, fungi, viruses living in and on our bodies, mostly in the gut. It's incredibly important for digestion, immunity, even protecting us from harmful germs.
And how does it relate to the baby?
Well, babies are born with a mostly sterile gut. They get seeded with their initial microbiome during birth and early life. Vaginal birth exposes the baby to the mother's vaginal and gut microbes. Skin-to-skin contact right after birth helps transfer skin microbes. Breastfeeding provides beneficial bacteria and prebiotics food for good bacteria.
So those things help build a healthy baby gut.
Exactly. On the flip side, things like antibiotics for mother or baby, cesarean birth, which bypasses the vaginal seeding, and formula feeding, which has a different composition than breast milk, can disrupt the development of the baby's microbiome.
And does that disruption have long-term effects?
Research suggests it might. An altered early microbiome is linked to potentially higher risks later in life for things like asthma, allergies, obesity, diabetes, and certain bowel diseases. So establishing a healthy microbiome early on seems pretty important.
Wow. So what can people do to support a healthy microbiome for themselves and their baby?
Great question. During pregnancy, you can support your own gut health. Taking probiotic supplements, look for strains like lactobacillus and bifidobacteria might be helpful. Discuss with your provider. Also, eat probiotic-rich foods. Yogurt with live cultures, kefir, sauerkraut, kimchi, other fermented foods.
And prebiotic foods.
Yes, those feed the good bacteria. Think onions, garlic, leeks, asparagus, bananas, oats, legumes, some starchy vegetables like Jerusalem artichokes. Basically, lots of fiber-rich plant foods.
What about during labor and delivery?
Minimize antibiotic exposure if possible. If antibiotics are necessary, focus on consuming probiotics and prebiotics afterwards to help restore your gut flora.
What if someone has a C-section? I've heard about vaginal seeding.
Yes, that involves swabbing the baby with the mother's vaginal fluids after a C-section. The idea is to mimic the exposure of a vaginal birth. However, the research on its benefits is still unclear, and major medical groups don't routinely recommend it due to potential risks of transferring harmful bacteria or viruses, especially if the mother has certain infections or the baby is preterm. It's something to discuss carefully with your provider if you're considering it.
Okay. And after the baby is born?
Encourage immediate skin-to-skin contact. Delaying the baby's first bath for at least 24 hours allows beneficial microbes from the mother's skin and the birth environment to colonize. And exclusive breastfeeding for as long as possible is one of the best ways to support a healthy infant microbiome.
That's fascinating stuff. Okay, we've covered a huge amount today. Let's try to summarize the key takeaways.
Absolutely. To bring it all together, remember to focus on building your diet around whole grains, a vibrant array of vegetables and fruits, and good sources of protein. Don't aim for absolute perfection. Instead, strive to make the best food choices you can each day.
Right. Be mindful of those key nutrients we discussed: folate, iron, calcium, omega-3s, iodine, choline. And definitely have an open conversation with your healthcare provider about whether supplements are right for you.
Exactly. Understand that those common eating-related discomforts like nausea or heartburn can often be managed with simple strategies. Or consistently following food safety guidelines significantly minimizes potential risks. It's about making informed choices.
Considering the profound and, well, amazing influence your food choices have during this time on your baby's development, what's one small positive change you could make today to your eating habits? Maybe one that feels achievable but impactful. It's a powerful question to reflect on.
Or maybe, knowing that even imperfect healthy choices benefit your baby, what's one new food from that rainbow of fruits and vegetables you're curious to try this week?
Great thought starters. Thank you so much for joining us for this truly deep dive into pregnancy nutrition.
My pleasure. It's such an important topic.